Welcome to finding high-quality evidence in PubMed. A long list of search results doesn't necessarily mean you found a strong answer. The key is knowing how to identify evidence that matches your clinical question, uses the right study design, and is reliable enough to inform your decision. In the next few minutes, you'll learn a simple, repeatable process for moving from a list of PubMed results to the best available evidence. Start with a focused clinical question. The PICO framework helps you identify four key elements: the population, intervention, comparison, and outcome. Together, these elements define what evidence is relevant to your question. Even a well-designed study may not be useful if it examines the wrong patient population or measures a different outcome. As you review your PubMed results, use your PICO question as a quick test to decide which articles are truly relevant. Next, match the study design to your clinical question. If you're evaluating a treatment, a randomized controlled trial is often a strong choice. For a diagnosis question, look for a diagnostic accuracy study that compares the test with an appropriate reference standard. For a prognosis question, a cohort study can show what happens to a group of patients over time. Remember, high-quality evidence starts with the right fit, the right study design for the question you're asking. Evidence pyramids can help you understand the general strength of different study designs. However, the highest level on the pyramid is not automatically the best choice for every question. Systematic reviews summarize evidence from multiple studies, while randomized controlled trials are often used to evaluate treatment effects. Observational studies and case reports can be especially valuable when exploring prognosis, rare harms, or unusual clinical events. Use the evidence pyramid as a starting point. Then consider the study's relevance and the quality of its methods. In PubMed, article type filters can help you focus your search results. Depending on your clinical question, you might select systematic review, randomized controlled trial, or meta-analysis. Keep in mind that recently published articles may not be fully indexed yet, so they might not appear when these filters are applied. Think of filters as a helpful shortcut, not a guarantee that you've captured every relevant study. The article type is only a starting point. Next, open the abstract and take a closer look at the study's methods. Ask yourself, were the comparison groups appropriate? Is the study population similar to the patients you're interested in? Were the outcomes meaningful and measured fairly? Even a randomized controlled trial or systematic review can have important limitations such as poor execution, indirect evidence, or selective reporting. That's why identifying the study design never replaces critical appraisal. You can quickly evaluate an article by looking for 5 key signals. First, relevance. Does the study answer your clinical question? Second, design. Is the study design appropriate for that question? Third, bias. Could the methods have influenced or distorted the results? Fourth, precision. Are the findings reasonably certain, or is there a wide range of uncertainty? And fifth, currency. Is the evidence recent enough for your topic? Together, these 5 checks provide a quick initial screen before you examine the article more closely. Here's a simple workflow you can use every time. Define your clinical question, filter for the most appropriate study designs, and then appraise the articles that remain. Don't select an article simply because it appears first, is the most recent, or has an impressive label. Instead, choose the study that best fits your question. Then, examine its methods and consider its limitations. That's how you turn a PubMed search into an evidence-informed decision. If you need additional help searching PubMed, selecting the right study design, or evaluating the evidence you find, contact your librarian. Librarians can help you develop an effective search strategy, locate relevant research, and identify reliable resources. You don't have to navigate the literature alone. We're here to help.